Hi, I'm doing my project on suicide, and I think this has been something that's been on the rise due to a lack of compassion because I think a lot of people are overridden with anxiety and depression and just feeling really overwhelmed. And I think when it gets to that state and it happens frequently, um, people tend to already feel so alone as it is. And when other people around them don't understand or empathize or show kindness or understanding to what they're going through, I think that multiplies it to a degree that's just a lot more tougher to deal with. I think when you're going through something like that and you feel that people they understand you, or even if they can't relate to it, um, that what you're going through is normal, I think that would decrease the rate of suicide that we're seeing today. I think it doesn't take very long for that stress to quickly catch up with you, and it's almost like you lose control of your mind. And I think because maybe some people don't relate to it, there's not a lot of compassion around this. I think the things we're going through. So the intervention that I would introduce is, first of all, to have compulsory mental health evaluations yearly, especially like during high school and throughout college, because I think those are the prime years of when we deal with the most anxiety, especially before we're taught how to manage our stress and, you know, deal with all these changes. Um, I think when you get a bit older, maybe you learn how to better manage it, but it doesn't ever really go away. So I think having, we have like physicals that we have to do, and if we don't do them, we can't enroll in school. But there should be also mental health checks to have these yearly meetings with a counselor or advisor and evaluate your mental health, your anxiety, your depression, and how you're dealing with it, and be able to know about the resources and have them at your disposal. I think there are arguably a lot of resources out there even today, but I think we have to realize that people who are depressed don't necessarily go out of their way to seek these resources. So they may not have the ability, or the willpower. So I think that needs to be taken into account. I know for me personally, I never knew about the resources just because I never had the willpower or the effort to even seek it out. So I think it needs to be something that's very easily accessible to all students. And the way that I would design it is just by simply having a mandatory, before you're able to enroll in classes, to have a mandatory meeting with an advisor. If it is evaluated that a student may need additional resources, or they have an especially difficult time dealing with their stressors or have something going on in their life or health issues, that we would increase these meetings as we deem fit. So it's not a choice of theirs, because obviously for most people, they would rather not deal with it, or they don't think it's a big deal. But I think it needs to be something that has to be mandated, because it is a rising issue and not everyone is comfortable dealing with it, but it needs to be faced. The audience is primarily youth between ages 15 to maybe 22 or 25. However, I wouldn't say that it's something that's not even necessary to implement at workplaces. I think a lot of people, even into their 30s or 40s, may not be able to identify or deal with their depression and anxiety. So I think it's something that needs to be very much integrated into society, into all aspects. But my primary concern would be adolescents and young adults. And my dream team for the project, the people that I would pick to be on board of directors, I guess obviously, since it's something that I want to implement at many schools, it would just be primarily people, psychologists with a background in psychology or social behavior or social workers. But I think it is necessary for them to have at least some training specifically in how to deal with anxiety and depression and to be able to identify the risk factors of suicide, and have that be a conversation that they know how to implement and how to deal with, um, so that students don't feel intimidated to go and seek help when they feel they need it. Um, Overall, I hope this will at least help the situation a bit so that we don't see as much suicide as we're seeing among young people. Thank you.